This Focus on Health segment is brought to you by Aurora Healthcare.
Hello and welcome to Focus on Health. I'm Ted Stefaniak. Today we're actually in North Fond du Lac to visit the Aurora Health and Wellness Center. Now, they specialize in integrative medicine, including acupuncture. Now, I'm a little squeamish about needles, but I still sit down with Dr. Tamara Lyday. Well, thank you for taking some time with us today. Acupuncture. You know, I think of acupuncture and I think of the needles right away. But I mean, it's not necessarily a painful process, is it?
No, it's not painful at all. In fact, people who are scared of needles usually have no problem with acupuncture.
Yeah. So what is the purpose of acupuncture? Tell us a little bit about it.
So acupuncture started about 3,500 years ago in China, and it was always known as kind of an Oriental treatment modality. You know, people think of it, they think of an Asian man putting needles in your body and healing disease. Back then they talked mainly about acupuncture healing your qi. So qi is your natural life force. It runs, they say it runs in meridians throughout your body. You have 12 main meridians and 8 secondary meridians. And these are like, when you think of the points, such as on my model here, when you think of the points, each meridian is labeled. And those are the points that contribute to the qi flowing throughout your body.
So it's an integrative medical practice, correct? So how does it actually work, though? I mean, you're trying to find trigger points?
It's basically like a trigger point. So the Chinese, Asian medicine men would say that what would happen is almost like if you have a stream and a tree falls and stops the flow of the stream, that's sort of what happens in the human body. So whether we do it through diet or we do it through putting bad things in our body, whether it be toxins or alcohol, there's something that happens that stops the flow of the qi. So by inserting a needle into it, it's almost like taking that tree and digging a little hole. The water can then run through it and eventually get rid of the tree. So by piercing that little blockage, our body just naturally will realign.
Yeah, I know you said you wanted to show me how it felt. I did not want to do that. And again, I'm afraid of needles. But again, not a painful. I mean, it sounds like when you're trying to find a point, it might be painful, but pain, you said, is not an issue with it.
I haven't ever had anyone complain of pain, and I've treated hundreds of patients. You look for kind of like a zing, almost like when your foot is about to fall asleep. That zing is sort of what I'm looking to feel, and I can feel that through the needle, and that's what I'm looking for. Most of my patients fall asleep during treatment. Yeah, it's very relaxing.
So who would benefit from acupuncture?
So National Institutes of Health, and I think it was 1997, came up with a list of conditions that it's definitely shown a benefit in. Addiction medicine, it's been shown to be very good in terms of weight management, cigarettes, alcohol. Those are all really good treatable conditions, which is great for Wisconsin in a couple different categories. Sure. It's been very great for myofascial pain syndrome. So anything that's going on with tissues, tendons, bones, so chronic arthritis of the knee. I have a couple people that were able to get away from having surgery by acupuncture treatments alone. Wow. Tennis elbow responds really well, golfer elbow, any of those tendinitis. Chronic headaches, migraines. Sometimes if you get a person at the onset of a migraine, you can stop them from having a migraine or even decrease the duration of the migraine.
Is it a treatment that can be, the problem can be fixed with one treatment, or is it an ongoing process of having acupuncture?
It is an ongoing treatment. And I tell people that the longer they have the condition, the more treatments it'll probably take to fix it forever. A typical session is about 12 treatments, and I do 3 a week if they can. Obviously, it's difficult when people are working and, commitments from the family and everything, getting in for treatments. Sure. But I like to do 3 treatments a week for 4 weeks. They will know after that 3rd treatment. It usually takes about 3 treatments for them to be like, oh yeah, I feel significantly better. Some people feel it after the 1st. I would say probably about 80% of people feel it after the 1st. But after the 3rd, I can tell them whether I'll be able to cure them. After those 12 treatments, some people have 100% resolution. I never see them again. Some people have 100% resolution, and then like 2 months down the road, they're like, oh, I'm feeling a little achy again. So they come in, I call it a tune-up. Yeah. So they'll come in and just have 1 treatment, and that'll put them back to 100%.
Are there cases where acupuncture doesn't work for a person?
There are. I truly believe in mind-body medicine. So I think a lot of times I'll have people come in for a consult and they'll be like, my daughter, she told me to do that. I don't believe in this hogwash, but she told me, so I am here. And I'm like, I don't know if you're going to want to spend the time and the money to have this if you truly don't believe in it. So I have had a couple of cases where it hasn't been successful.
Sure. Okay. And we've been talking about acupuncture. There's also acupressure. What's the difference between the two?
Acupressure, you don't use needles.
Okay.
So you use the same points on the body, the same meridians, the same 2,000 points, but instead you use pressure as opposed to the needle. It's a little more time consuming for the practitioner, and it's usually what most masseuses do. They find those acupressure points, and that's what they use to release muscles. Okay. So I use more acupuncture because I actually use the needles, because that way I can stimulate the point for 20 minutes. As opposed to just keeping my finger.
There you go.
Because it would be like Twister.
Now, you also have some really exciting things happening in North Fond du Lac. You practice mostly out of North Fond du Lac. Really exciting things happening here at Aurora.
We do, yes. We're trying to create a whole body wellness center. So by doing that, we are bringing in massage. We have a chiropractor. I'm a trained nutritionist as well as an acupuncturist, and I do both integrative and functional medicine.
Wow. A lot of things happening here in North Fond du Lac. Hey, thanks for taking so much time with us.
Excellent. Thank you.
It's certainly a fascinating topic. If you want to learn more, you can always check out aurora.org and look for integrative medicine and acupuncture. You can also give Dr. Lyday a call at 303-8700. I'm Ted Stefaniak, and we'll see you next time on Focus on Health.
This Focus on Health segment has been brought to you by Aurora Healthcare.